summer has come and gone for the year, sadly. That means we are naturally spending a little less time in the sun. But this is also the time when you might notice that your skin is a bit dull. Maybe you're seeing those obvious signs of sun damage. Ann Therese Aesthetic Medicine knows all about that problems, and Dr. Ann Therese Stubbs herself here to make it all better. I like that. Kiss our boo-boos, heal us up, Dr.
That's right.
Ann, right?
There's a laser for everything. That's right.
So there is a fine line, you say, between that kind of fresh sun-kissed complexion and then that sun damage skin tone.
Right. So the UV rays, there's UVB and UVA rays that hit us every day, even when we're driving around in a car. The UVA rays tend to be the longer wavelength that goes through the windshields and the windows, and it can damage our collagen and make the skin look kind of, like you said, a little duller, a little bit more hangy, more wrinkles. And the UVB are the tanning rays, and they can give you that nice sun-kissed tan look, or they can start to cause brown spots as we age. Some people call them liver spots, age spots, sunspots, but those spotty looking areas from the sun are not things we're looking for.
And it's all, I mean, really a lack of sunscreen in a lot of cases, especially when most people don't on a daily basis.
Right, and that's a good point that you brought up. Even in the wintertime, we should all be wearing an SPF of at least 30 or higher on our faces every day. Even driving around in the middle of winter, we do get that UV damage, both for skin cancer protection and for age spot protection.
Okay, there you go. All right, so let's talk about this Fraxel laser. So this is kind of a very targeted treatment, right?
Fraxel is a fractionated laser, so it's something that takes sun damage off. It can build collagen, so it's for fine lines, wrinkles, and browns as well. Even melasma. This is really tough pigment. Melasma is usually caused by a combination of sun damage and maybe some hormonal changes like menopause or birth control pills can sometimes cause folks to get melasma, which is kind of a dark pigment. It's the only laser approved to get rid of melasma, which is nice. But it's fractional, as I said. It doesn't peel the skin. It puts little dots of energy in the skin and goes down deep to target those pigmented areas, but it doesn't peel the surface layer. So that allows people to go back to work, to put makeup on, to put sunblock on, and go about their daily activities, and that's huge.
All right, before and afters we're going to check out here, Dr. Ann. Always fun to see, and these are pretty dramatic.
Yeah, it's probably the deepest laser we have, and as I said earlier, it's kind of an oldie but a goodie. It's been around for 13 years, and its fractional aspect, meaning the fact that it doesn't peel and it doesn't take off the top layer of skin, makes it something that people can do and go right back to work or their daily activities. All these gals that you're seeing have had 4 treatments, 1 month apart.
Okay.
So we usually do it in a series of 4.
Okay, so as you do these, you're saying recovery is pretty much nil.
Well, you're a little red that day, and maybe the next day your skin looks a little bronzy, almost feels a little sandpapery to the touch, but it doesn't look rough at all. And we do other areas, as you're seeing, hands, décolleté. These are areas that people often forget to put the sunblock on, and then over time people are telling me, oh, my hands are aging me, my chest, my neck skin doesn't match my face. I've been putting the sunblock on my face, but maybe I've forgotten my hands. If you think you're driving, that's exposed to the sun all day too. So the browns on the hand and the crepey skin on the hands age people too. So it builds the collagen, tightens the skin, and takes the browns off.
I love too that this can be used for acne, which is a problem that many teens, young adults have.
Huge, wonderful adjunct to our acne protocols. So this is a young gal here. You're seeing her head on in the middle, and her before pictures are on top and after on the bottom. And she was just plagued with just cystic acne that would not quit, and the scars that continued. So the Fraxel does 2 things. It shuts down the oil gland, so it can get some of that cystic, oily acne under control, and then it works on the scars, all those pitting kind of ice pick scars that acne patients suffer from that make it even difficult to put makeup on because they feel that the makeup sinks into those areas. So this is a wonderful laser for building the collagen and combating the scars and also shutting down the oil gland.
All right, and today's offer, Dr. Ann says she wants to help repair your skin with 30% off. So
That's
a great
right.
deal if you
Exactly. Come in. So this is our kick it off for fall special, get the sun damage gone, but we always do a complimentary consultation to make sure that this is something that is right for your skin. Fraxel is something that can be used on even darker skin types, which some of the other lasers cannot be. We can use this on people of color. We can use this on darker skin types very safely.
All right, all it takes is a phone call. All the info up there. Thanks, Dr. Ann.
Thanks for having me.